Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
The ability to achieve sexual and reproductive health rights, including being able to decide when and whether to have children, is critical for health and well-being of all women. However, Uganda still has serious gaps regarding equitable access to sexual reproductive health services for its young population, majorly affecting women. A 2019 study by the Guttmacher Institute found that an estimated 648,000 women aged 15 to 19 in Uganda are sexually active and do not want a child in the next 2 years. However, among this group, more than 60% have an unmet need for modern contraception, meaning that they either use no contraceptive method or use a traditional method of contraception. This means the targets as set in the 2015-2020 Family Planning Costed Implementation Plan have not been fully met. Dr. Betty Chadondo, the Director, Family Health at the National Population Council, says the country's performance can be determined by the indicators of universal health coverage.
The reproductive health statistics of Uganda, it clearly shows that Uganda is not performing very well in some of those key areas of reproductive health. For example, the fertility of Uganda is considered to be relatively high. Reason being, our girls start giving birth when they are still young. Because of the high fertility, then we end up with complications during birth, complications during pregnancy. So our maternal mortality ratio as a country, the number of women that die during birth or during the time that they are pregnant is also high. And this, we lose about 16 to 20 women every day because they are bringing lives to this world. And this is a disturbing figure, definitely. But I would also have mentioned that we have over 1,000 girls getting pregnant every day when they are below 18 years.
The challenge we have are deliveries that are carried out outside the facilities. And when there is a problem, they are brought into the facilities. And sometimes they've already gotten infection and it is difficult to manage. But also, in addition, mothers who go into labor and come to the health facilities late. Now, this will be addressed by the community health extension workers, linking the mothers to health facilities.
The Family Planning Costed Implementation Plan was a 5-year strategy estimated at $235 million, approximately 872 trillion shillings. It was meant to improve demand creation, service delivery and access, contraceptive security, policy and enabling environment, among others, and targeting to increase the number of women using modern contraception methods from about 1.7 million to 3.7 million by 2020. Uganda's poor performance is directly linked to poor access to sexual reproductive health services. The outcomes, including poverty, conflict, unwanted and unintended pregnancies, violence against women and girls, normally affect young people aged 10 to 24 years. Young people, women in particular, face numerous challenges that prevent them from using quality sexual reproductive health services, including stigma, fear of contraceptive side effects, and unaffordable healthcare costs. Dr. Charles Olaro, the Director of Clinical Services at the Ministry of Health, says they are cognizant of the challenges.
If we have to realize our vision 2040, then we have to be able to invest in family planning. And family planning is one of those key pillars of safe motherhood. There are about 6 pillars, but one of the key aspects of it, one of them is one. So we need to look at it not just as a health issue, but a socioeconomic aspect of it, because you cannot get people out of poverty if the population continues to grow, so that the demand side is always bigger, much more than the supply one.
Dr. Olaro adds that they have some solutions in place.
We've done one warehouse, one health facilities. So the two facilities, both the government and the private one, are able to communicate so that if the products are not available in the government, in national medical stores, we can move commodities from the joint medical stores into to the national medical stores, vice versa. So wherever there are commodities, so JMS will supply the private not-for-profit, and then NMS will supply the supplies on the what. We, as a ministry, we've moved and allowed even shops to be able to dispense family planning commodities, so that those who are able to get to the shops, and normally drug shops are available almost in the whole community, so those which can able to access. So those who have probably some fear factor, they are not able to get the facility, then they can be able to access.
In spite of all the challenges, government made new commitments in November 2021 to increase funding for family planning. This is coupled with creating partnerships. One of such partners is Population Services International. The Director of Programs, Peter Buyungo, says they are implementing the Selfcare strategy to facilitate access to sexual reproductive health services.
So in Selfcare, we have funding from CIF, which is the Children's Investment Fund Foundation. And they are funding two streams of work. One is around strengthening HIV self-testing in the private sector. And in this case, we are trying to build a market in the private sector so that the private sector can support the public sector in provision of HIV self-testing. The second area of self-care is delivering innovations in self-care. We call it the DISC project. This is again trying to scale up self-injection within the country. Self-injection contraceptives. So this is a new method that has been introduced over the last few years, but we want to bring it to scale to get more people to use it. And we are working with this, with the Ministry of Health around this. We're also supporting Ministry of Health to develop the national self-care guidelines for SRH. These will now enable all the players in the country to work and ensure that we can embed self-care as part of the way of doing business as we provide support to communities.
Buyungo says they also have programs focused on the youth.
We've developed a program under our Your Space brand. It's a youth program, and it enables or empowers the youth to access information that they need to make positive decisions around their SRH needs. Even as we struggle with the poverty, we need to ensure that resources are available to serve both the poor and the rich. And how do we do this? Is by ensuring that the market is set up in such a way that the poor are able to access the public sector, and then the rich, or those who can afford, have access through the private sector. That means you're creating a total market approach in us.
If all unmet need for modern contraception among adolescent women in Uganda were met, unintended pregnancies among this group would drop by 72%. Additionally, if full provision of modern contraception were combined with adequate medical care for all pregnant adolescents and their newborns, adolescent maternal deaths would drop by 76% per year. Walter Mwesigye, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities